going to start talking about Chapter 6 of your trail guide to the body. Chapter 6 is the pelvis and the thigh. So let's talk about pelvises for a second before we even go any further, just pelvises in general. So we all know how Tapscott is totally obsessed with feet, right? And I'm obsessed with feet because they're the foundation of the body. It's not a foot fetish. They're the foundation of the body, and small problems in foundations cause big problems upstairs. Just like small foundations problems at a skyscraper would cause the skyscraper to be very messed up. So foundation is everything. Well, you could argue that pelvis is right up there along pelvis is right up there along with feet. So let's talk about how bodies kind of work. And I don't know if I can get back here. I want you to think about how your body is divided up, how it's mechanically put together. And if you think about it, I've got these things down here, and they're designed to get me places. My legs are my wheels on my body, right? They're designed to get me places. That's what they're designed to do. And what are they taking to places? Right? They're taking my brain and this upper body to places. That's what the legs are designed to do. They're designed to take me to places. So I see a tree over there, and I go, oh my gosh, that fruit looks good. I shall walk over there, and my legs take me over there. Right? And what are my legs taking over there? Well, they're taking over the machinery of my body. So my torso is filled with most of the systems we've learned about. Right? My thoracic and abdominal regions are filled with things like my heart that pumps blood through my body so my legs work. They're kind of the engine of my body. My lungs, that are the carburetor to that engine, right? My digestive system is all in this torso area, really. Really is. So the machinery of my body, in many ways, the factory part is in my torso and my abdomen, and my legs carry that around to places. And when I get to those places, I use these to do stuff. Your hands aren't for walking, they're for manipulating stuff, for picking the fruit when you get there. So this is kind of the division of labor in your body. And the pelvis helps power your legs, and it is the connection point between your lower body, which is your locomotion, and your upper body, which is what it's carrying around. And your upper body really is kind of balanced on this pelvis. And if this pelvis is off, that causes all sorts of back problems. And we've talked about this before. So we are going to be studying the muscles of the pelvis and thigh, but we care a lot about what those muscles do, not just in movement, but really what they do in pelvic alignment. So if my muscles get tight on one side, not the other, I can have my pelvis tilt this way or that way. That's called a lateral tilt. I'm tilting to the side. And you will see some people that are kind of like this. They're a little laterally tilted. Usually, by the way, when they laterally tilt, their head goes back this way to help balance them out. So their shoulders going that way, their hips going that way, and their head's going that way to balance them out. I'm exaggerating, but this is the look. The other thing that we can see is, remember, we can have rotation of the pelvis. And if my pelvis is anteriorly rotated, the top is rotated forward, anteriorly rotated, I start to get exaggerated curves in my spine. And that causes problems in my low back and in my neck. If it's posteriorly rotated, which is less common but does happen, I start to lose the curves of my spine, and I get this very military neck or military back they talk about. That's not good either. And so as we kind of discuss the pelvis, I want you to be thinking about what these muscles can do to pelvic alignment, because a lot of times when people come to you with back and neck problems, they really have pelvis and feet problems. And most massage therapists miss that. They rub the back, they rub the back, they rub the back, and you should too. By the way, don't, if somebody comes to you and says, my back's sore, and you're like, well, it's really your pelvis, I'm not even going to rub your back, they'll be mad at you. Rub their back, it is sore. But pelvic alignment could be the real problem. And so we want to be looking at that too. Can we lengthen the muscles that are causing the anterior tilt, or the posterior tilt, or the lateral tilts, all that kind of stuff. Cool? Questions, thoughts about this before we go down this exciting area of pelvic and thigh? No? Okay. One last thing to remember too, your thigh is not your leg in medical anatomy. Your leg is your lower leg. Your leg is the thing below your knee. That's what we call your leg. We do not call your thigh your leg in anatomy. It's not your upper leg, it's your thigh. So you've got your thigh and your leg. Thigh and your leg. That's how we refer to them. It's just the way we talk. In the real world, we're like, those are your legs, but not in anatomy. So we're going to be discussing pelvis, which is your hips, basically, and thigh. And they're super duper cool, by the way. Super duper cool. And all of you have already had things like your glutes worked on and stuff. That's part of your pelvis. And you know how good it feels to get all those kind of tight muscles that people kind of forget about taken care of. Cool? All right, let me share this slideshow with you. And let's look. This is chapter 6, Trail Guide to the Body. Pelvis and thigh. Cool. Please feel free to ask questions. Please get back in the swing of things. Don't be afraid to ask questions that show that you forgot last semester. That's okay, right? We will do more review. Just jump right in. It's all okay. We all know each other. We all know that we, have good days and bad days when it comes to remembering stuff. I'm sorry, I should have done this already, but let me grab my leg model because it's really good and it'll really help us. Okay. All right, that's pretty good.
Now you just need a lampshade.
I know! It's one of my favorite movies, by the way, sir. Okay. So here we have a left leg. It's be on this side of my body, which I know is your right, but remember, it's the client's left. This is the client's left leg. Cool. And let's review a little bit the general muscles of the thigh, okay? So, and I'm going to go around and ask you questions about them too. In fact, let me stop presenting for a second. Let's wait. I'm jumping up ahead of stuff too. Okay. Let's, remember we've got the quads, and the quads are in the anterior compartment, which means front, and the lateral compartment. Quads aren't just in front. They're in the front and side. And remember, we have the hamstrings in back. I can actually grab them here. And we have the gluteal muscles. There's actually 3 of them. The gluteus maximus, medius, and the minimus is underneath here. And later we're going to learn about some muscles underneath the gluteals here called the deep 6, or the lateral hip rotators, that are extremely important because one of them can pinch the sciatic nerve that's right up in here too. And then there's also on the medial, the medial part of the leg, there was the adductors. Remember the adductors? There's 5 adductors. Yeah. And then there was one muscle that kind of stood alone. And it's this diagonal one. that goes all the way diagonal across here. Anybody remember what this muscle's called?
Is that sartorius?
It is. What's the nickname for it, Miss Monreal?
I'm not a creep. I don't know. I don't know.
Anybody?
Oh,
I'm sorry. Anybody know the nickname for the sartorius? No? The Taylor's muscle. It is the muscle that lets you sit cross-legged. And they call it, I know it sounds silly, but if you were a tailor, you would have sat cross-legged and kind of worked on your stuff. But it's the muscle that allows you to cross your leg. Think about this.
We talked about that before, and I don't remember going over the nickname of that muscle.
I've never mentioned it. By the way, Miss Petrie, highly possible that I never did go over it before, right? So I've taught the class like 9 times, 10 times here, and it's possible I'm just, but I thought maybe in passing I mentioned it. Does anybody else remember?
Probably.
Well, no, you've got several people agreeing with you, Miss Petrie, so I am inclined to agree with your guys' version of reality. Well, let me explain, because it's kind of cool. Can we see this muscle here? What we're going to do, by the way, is take a little practice on kinesiology here. This muscle starts out here on my hip, okay? It goes down and across my knee. Across my knee. So, Miss Petrie, how many joints does this muscle cross? 2, yeah. It crosses the knee joint and it crosses the hip joint. So it can affect 2. It's going down here diagonally. So if you've got a muscle, let me get a piece of tape here. This is how I want you guys to think about kinesiology. If I've got a muscle doing this, I don't know if you guys can even see me here. I don't know if I can see me here. Hold on. Let's try this again. Hold on. I think I got a solution. Boom. All right. If I've got a muscle going diagonal across here, and it shortens, can we see that it might do this? It's actually pulling from the inside of my leg, right? So if it pulls from the inside of my leg, if you grab the inside of your leg below your knee, you bend your knee and pull your leg up like you're sitting like a tailor. Yeah. You're laughing, huh, Miss Petrie, because you know I'm about to fall off the chair. So it would be like a tailor. So it actually creates 3 movements. Who can tell me what 3 movements I just did here? Because of the sartorius. Somebody take a stab at it.
Abduction, rotation, and pronation.
I like your stab, by the way, sir. What kind of rotation?
Lateral.
Yes, he's exactly right, by the way. My thigh rotates out laterally because this pulls it like that. So that's the lateral. This is like they call it your Taylor's muscle, but I always think like your hacky sack muscle. This is the muscle you use to move the hacky sack. So lateral rotation is correct. What do you call this movement, sir, when I bend my knee like that?
Flexion.
Yep, flexion of the knee. So lateral rotation, flexion of the knee. And what's happening to my hip?
It's also flexing.
Yeah, flexion of the hip, lateral rotation, and flexion of the knee. Boom.
Right.
It's a very complicated muscle. But good job. Good job. Cool. That was just to kind of get us thinking about kinesiology again. Okay, so let's review general muscles of the thigh and stuff, just to make sure that we remember those, because it has been like an eternity since we've all been together. Okay? All right. So, does anybody want to tell me what the 4 quad muscles are before I call on somebody? Miss Stanley, you're laughing, smiling, you're shaking your head. I appreciate your honesty, but now I want to call on you, which I think is terrible on my part. I'm going to do it anyway. Miss Stanley, I have deep respect for you. I'll do it with you. I don't mean to be a jerk. It just comes naturally. But what are the 4 quad muscles? I can give you a hint, by the way. 3 have the word vastus in them.
I know one of them's vastus medialis.
Yeah, vastus medialis. Sorry, I have to look here. Hold on. Yeah, vastus medialis.
Vastus lateralis.
Vastus lateralis. Let me just show everybody really quick. Vastus lateralis. So we got the one on the lateral side, medial side. Yep.
The last one, for some reason, is not coming to me, and I don't know why.
Vastus intermedius, and can we see it in this model? We cannot, because it's actually underneath. Hold on. I don't know if these come off or not. We're going to find out. I'm going to do it. It's worth it. All right. Take off the sartorius. Vastus lateralis, vastus medialis, vastus intermedius. Kind of cool, by the way. You can now see what's going on here. There's a medial one, a lateral one, and an in-between one. Vastus medialis, vastus intermedius, vastus lateralis. And then there's this one that runs up and down, kind of like the rectus abdominis, your abdominal muscle, but it's obviously not an abdominal muscle. It's a muscle that runs up and down on your femur. So what's it called, Miss Stanley?
Rectus femoris.
Rectus femoris. Thank you. Mr. Kandaris, I think you raised your hand because you knew, correct?
No, well, yeah, but is the white in your model representing tendon or fascia?
Is it? I'm sorry. Say your question again.
Is the white representing tendon or fascia or something else?
Yes.
Which one?
Yes.
Okay.
So why did I tell him yes when he said, is it tendon or fascia?
Tendon.
Yes.
Because aren't tendons also fascia?
Yes. Tendon, by the way, Mr. Kandaris, it's tendon. That's very specific what it is. Tendon attaches muscle to bone. And that's what tendon is. But tendon is a form of fascia. So our ligaments are a form of fascia. So it's more precise to say it's tendon, but tendons are fascia, ligaments are fascia. It's connective tissue.
You know, I was just curious because I guess the intermedius right there, it looks like more tendon than it is muscle.
Yeah, it looks very tendinous. Yeah. And so it's got a smaller belly and a longer tendon. Yeah. And I don't know why that is, to be very honest with you. But it apparently is true. Yeah.
I just had never noticed that.
Yeah. And we don't ever see this one. We rub this one, but we rub it by going through the rectus femoris. Yeah. Cool. Thank you, sir. So, Miss Hanson. Thank you, by the way, Miss Stanley. Miss Hanson, what are the 4 quad muscles? Slowly so I can point to them.
Vastus lateralis, vastus medialis, vastus
Intermedius.
intermedius, and rectus femoris. Am I saying that right?
Rectus femoris.
Femoris.
Beautiful. I love that. Okay, cool. Cool. Miss Bolotic, what are the 4 quad muscles?
Vastus intermedialis, Vastus lateralis, and then vastus medialis, and then the rectus femoris.
Nicely done. Yeah. By the way, I think it's vastus intermedius, but intermedialis is close enough. Yeah, it's close enough for me though. It shows an understanding. It's fine. Don't worry about it. Miss Moore. If you don't know, by the way, Miss Moore, don't stress. You have been out of school for about a year. So, but Miss Moore, are you there?
Yes.
Miss Moore, can you tell me the 4 quad muscles?
Vastus lateralis, vastus medialis, rectus femoris, and
You're doing great, by the way. Vastus intermedius.
intermedius. Yeah.
Between is what it means. Good job. Good job. I love it. Okay. Miss Nguyen, what are the 4 quad muscles?
Medialis.
Yes. Good job. Vastus medialis. Really good.
Lateralis.
Vastus lateralis. Yeah.
And intermedium.
Yeah, intermedius. Vastus intermedius. Really good. And then
And rectus femoris.
rectus femoris. Really good. Cool. Yeah. Awesome. I love it. Miss Hunter. Miss Hunter, can you hear me? No? All right. Well, let me know when you can.
I can hear you.
Oh, good.
I
Miss-
can hear you. Sorry.
Don't be sorry.
It just takes me a long time to open the thing to press the unmute. Anyway, sorry.
No, I understand, actually. I've been on the phone. You're right. Anyway, Miss Hunter, what is the quad muscle that I find on the lateral compartment of the body?
Lateral side. That was lateralis.
Yeah. What are the 3 quad muscles that I find on the anterior side of the body?
Medialis. Vastus medialis. And vastus intermediate.
Yeah. And what's the one on top? Most superficial. One more.
That one. Femoris.
Rectus femoris. Thank you so much. Hey, what is the strap-like diagonal muscle that runs on top of all of them? It's the most superficial thigh muscle of all.
Oh man. Crosses that knee, right?
Crosses the knee, yes.
I forgot it's Sartorius something.
That's Sartorius is it. Not Sartorius something. You got it.
Okay.
For somebody who forgot, you remember pretty good. Yeah.
Oh, okay.
All right. Thank you, ma'am.
I always anyway, that's fine. Okay, it's Sartorius. Perfect.
Cool. All right. Let's see what we got here. Okay. This is the inner thigh. This is the medial side of the leg. All right. I'm actually going to take off this. This is the sartorius. There. Get it out of the way. Okay. All right. Who knows the 5 adductor muscles? These ones are tough. Oh, I got a hand raised. Miss Monreal, take it away. Miss Monreal, you raised your hand? You got me all excited? Now you're not talking?
Hang on, can you hear me now?
Yeah, I can hear you now.
Okay, gracilis.
Okay, stop. You're 100% right, but stop right there. I want to show people something. The gracilis is your longest adductor muscle. It's going to cross the knee too. It comes all the way down here. Yeah? Let me raise this table a tiny bit. Oh. Do it? Yeah. Yep. It goes all the way down here. Gracilis, right here. Let's take that off. Okay. Alrighty. Go ahead.
Okay, and I'm not sure if I'm correct or not, but is the first word adductor or no?
Yes, you've got three adductors. Three with the name adductor in them.
Okay, adductor magnus, adductor brevis, and adductor longus?
Yes.
Okay.
And then you got a tiny one starts with a P.
Pectineus.
Pectineus. Yeah. Actually, that might not even be pectineus here. Let's see. It's not. Pectineus is here. Okay. So some of these we can see and some we can't because they're hidden. But your longest, good job, by the way, Miss Maria. Your longest adductor is your gracilis. It crosses over the knee. It's the only one that crosses over the knee. Your biggest, thickest adductor is your adductor magnus. It's also kind of in back. The other adductors lay on top of it. Then you've got like adductor brevis here, pectineus, and adductor longus is kind of hidden back there. We can't see it. But it's in there. It's in there. Good. Okay. Tricky stuff. Tricky model. All right. Miss Petrie, what are the 5 adductors?
Adductor magnus, adductor longus, adductor brevis, gracilis, and pectineus.
Yeah. Pectineus is up here in front. Brevis and longus are in here. Magnus is in back, and gracilis is all the way down the side. Really good job. Cool. Miss Cooper. Are you there? Usually she jumps in from the side. Yeah, bam. Hi, Miss Cooper. What are the 5 adductor muscles?
Dr. Brevis, Longus. Wait, why are you pointing?
No, you're right. I'm just saying they're in here. Don't worry.
Magnus,
So you got adductor longus, brevis, and magnus, which are the 3. And then there's 2 that don't have adductor in them. One's really long and goes across your knee, but it doesn't have the word long in it. Starts with a G. You there?
Go card?
Gracilis.
Gracilis.
And what?
Pectineus.
Yes. So what were the 5 adductors again?
Adductor brevis, magnus, and longus, and then gracilis and pectineus.
Good job. Thank you very much, ma'am. That was great. That was excellent. I love it. Miss Felix Osuna.
Yes.
What are the 5 muscles found in the medial compartment of the leg?
Adductor brevis, adductor longus, adductor magnus, pectineus, and gracilis.
Cool. Thank you. Thank you, ma'am. Miss Harper.
Yes, sir.
Let's do a little review. What are the 4 quad muscles found on the anterior and lateral compartments of the leg?
The vastus lateralis, vastus medialis, and then vastus intermedius, and then rectus femoris.
Cool. Which one or ones crosses over 2 joints?
Crosses over 2 joints. It means like in the middle of the 2 joints. Oh, crosses the 2 joints. Okay. The rectus femoris.
Yeah. Stop right there. It's the only one that crosses 2 joints. So everybody, all the quads go down into the knee. All the quads go down to the knee, and then they attach into your patella, your kneecap, and then go into your leg. So all 4 quads help me to extend. All 4 quads, really quickly, all 4 quads help me to do that, to kick. Because they all hook down into my leg and grab it and kick. But only, and most of them, by the way, attach and they kind of hook to my thigh here, to my femur. Only one crosses over the hip and actually hooks into my hip bone, and that's the rectus femoris. So the rectus femoris can cause me to kick my leg out like that and lift my hip up too. What are those 2 actions called, Miss Harper, that I just did? That and this.
Extension of the knee and flexion of the hip.
Yeah, it's the only extension that happens in front of us. Extension of the knee and flexion of the hip. And by the way, this is a flexion of the hip, but so is this, right? It's the same thing. The muscle can do the same thing. Well, what is this called? It's a flexion of the hip, but it's also a, what kind of?
Tilt.
Yes, what kind of tilt of my pelvis?
It's anterior tilt.
Yeah, that's excellent, and that's completely right. Thank you, Ms. Harper. Hard questions, you did really good. Anterior tilt of the pelvis. Now, you don't walk around like this, so what you do is you start to bend your back way back to try to get yourself balanced out again. And then you kind of get this kind of thing going on. It causes all sorts of neck and back problems. Yeah. Thank you. Thank you, thank you, thank you. So, Ms. Yanez, Ms. Harper kind of told us the answer to this, but so which muscle, which quad muscle could be responsible for anterior tilt of my pelvis?
Your rectus femoris.
My rectus femoris, yeah. Yeah, she's absolutely right. That is the quad muscle that could be responsible. Could the sartorius also be responsible, Ms. Yanez?
Yes.
Yep, because it creates a flexion of the hip too. The sartorius also creates a flexion of the hip. It comes across here like that. Yep, really well done. Good stuff. Cool. So, if you have somebody who sits at a desk for a long time, they're anterior tilted, working the front of their thighs is not a crazy idea, and stretching the front of their thighs is not a crazy idea. Yeah. So, Ms. Torres.
Yes.
Super hard questions. What movement will stretch the quads?
Footing of the knee.
What of the knee?
Flexion.
Yeah. She's dead on right. The quads come here. If I flex like this, I am stretching the quads. That's awesome. So, Ms. Torres, what movement would stretch the rectus femoris?
Well, the same.
The same. What would make it? What would emphasize the rectus femoris?
Flexion of hip.
How about extension? Rectus
Yeah,
femoris does this. So if my leg goes back, that stretches my rectus femoris. If I'm flexing and bringing my leg back, that really stretches my rectus femoris. So this is a very good stretch to bend the knee and bring the leg back to stretch the rectus femoris. You'll notice it's a lot easier to hold your leg like this than it is back like this, because that's because you're starting to stretch the rectus femoris. Good job. Hard questions. Cool. Okay.
I have a question.
Please.
So why is that sartorius? Is that how you say it?
Yeah, sartorius.
Not part of any of those groups.
I don't know. Let's explore that. Okay. Well, all of the quads, let's just take the quads first. All of the quads insert into the patella via the patella tendon and go from the patella via the patella ligament into the tibia. The sartorius doesn't go into the patella. Right? All of the quads create an extension of the knee. The sartorius actually creates a flexion of the knee. It actually grabs down here and bends it in. So it can't be part of the quads because it doesn't go to the same place and it doesn't do the same thing. Boom. It could be part of the adductors. It kind of is on the side down here, but it doesn't adduct the hip. So it doesn't really pull the hip in. If anything, it pulls it out a little bit. And so it can't be an adductor because it doesn't have an adduction action. It has a lateral rotation, flexion of the hip, and flexion of the knee. So it just can't be called an adductor because it doesn't adduct. It does help flex the knee, so I guess you could argue that it could be part of the hamstrings, but it's not found in back, it's found in front, and it just doesn't make sense. It really is a lone muscle. It just doesn't go with anything else. It's a very strange muscle. And want to make sure you could argue this a little bit, okay? But it's really the only muscle out of any of these that does 3 actions. Now, don't get me wrong, your book's going to be like, well, these other ones do a tiny little rotation of this little thing. Yeah, but this thing does 3 main actions. It really is this kind of lone wolf. It really just isn't part of another group. Yeah. Did that answer your question?
Poor muscle.
Poor muscle, but it is on top.
Like,
yeah. Let me tell you all, by the way, this is massage therapist tip. I know sometimes with anatomy you're like, hey, but massage therapist tip. Very, very interesting. A lot of massage therapists will be rubbing up the thigh like this, and they catch this sartorius here. They don't know that's what they've caught. And when they do, it stretches out here, and all of a sudden it pops underneath their thumb. And that's fine. That's not a big deal. But when it pops underneath their thumb, they think they've run across a knot. And they're like, oh, you must have a knot in your thigh here. Which they might, but 99% of the time, it's the sartorius. And they don't know their anatomy very well. They're going up the thigh, they're stretching out the sartorius, they pop over this little belt-like thing, they pop over it, and they can't see any of this, right? There's a sheet over it called skin. And they pop over it, and they don't realize that they popped over the sartorius. So it's very normal to be stroking somebody's thigh up and have a little pop underneath your hand. What you're doing is you're stretching out the sartorius, and it's popping underneath your hand. Just a good thing to know. We talk about this in the back too, right? You're going up somebody's back, up their spinal erectors, up their erector spinae, and you go across the rhomboids. The rhomboids run the other direction, and people go pop, 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 and they think these are knots. They're not. The rhomboids running the other direction. You've just gone across a different direction of railroad tracks, so to speak. That's why it's kind of good to know your anatomy. I mean, that's one of the 35 reasons why it's good to know. But cool? All right. So that leads us. By the way, if all this feels like I remember talking about this, but I have forgotten everything, it's going to be okay. That leads us to the back of the leg. The back of the leg. Yeah. Okay. So, on the back of the leg, what muscle group do we find on the back of the leg, Mr. Kondaris?
Hamstring group.
Thank you, sir. And what are the hamstring muscle names? Do you know?
Femoris, semimembranosus, and semitendinosus.
Yeah, thank you. Thank you very much, sir. Miss Bilotic, what are the 3 hamstrings?
The bicep femoris, the semimembranosus, and then the semitendinosus.
Yeah, very good. Thank you, ma'am. Miss Moore, what are the 3 hamstrings?
bicep femoris, semimembranosus, and semimembranosus.
Awesome. Thank you. Thank you. Thank you. Miss Felix Osuna, what are the names of the 3 hamstrings?
Bicep femoris, semimembranosus, semimembranosus.
Cool. So how many hamstring muscles are there?
3.
Cool. And how many heads do they have in total?
There's 4.
Yeah. Everybody, this is really important because this other stuff is just names. But you have 2 heads on this side and 2 heads on this side. And they go to opposite sides of the knee. And these muscles right in between here can get stuck together. So they have, not only do they bend your knee, they cause a flexion of your knee, but they can affect knee alignment. And you do not want your knee out of alignment when you're running around on it. So sometimes in runners and athletes, we'll actually take an elbow and very carefully kind of split up here between the hamstrings, which is a lovely sensation, by the way. Just like being gently caressed by a baby's hand. It's excruciating, but it works. And you put an elbow right, this is the knee, you don't want to put an elbow right there, but you put it right about there, and you slowly separate these guys, and it allows them to operate separately and keeps your knee in really good alignment. It's very effective. Because you've got 2 heads, right? On the lateral side here, you've got 2 heads, the biceps femoris, 2 heads. Here's the top head, right? We're going to have to take off the glutes here to see it. Here's the top head. And underneath it, come on, you can do it. There. It's hard to see here, but there's the bottom head. Back in here. The bottom head does not go across the hip, but it still bends the knee. So it's really important. So this side has 2 heads going to it. They go to the lateral side of the knee. And this side has 2 heads. I can pull this off, but it won't let you see both because they're both hooked together. It's showing you both. That's the semitendinosus, and that's the, actually, this is the semitendinosus. Oh, jeez. This is the semitendinosus, this is semimembranosus. It doesn't matter, they're both on the medial side here. That's what really is important. So my big point is, yes, your hamstrings bend your knee, but they can have a lot to do with knee alignment. So when people come to you with knee problems, working the hamstrings makes a lot of sense. And splitting between them makes a lot of sense. You're not truly splitting muscle, but you're helping separate this fascia that gets gummed up here together so they can pull more evenly. Now the hamstrings, 3 out of the 4 of them, create 2 movements. 3 out of 4 of them create 2 movements. They all bend the knee. They all flex the knee. They're down there and they pull the knee up. But they also hook to the back of your hips here. So what is the other movement that the hamstrings create? Anybody besides flexion of the knee? Who said that? What? I can't see. Who said it? Oh, Miss Hanson, good job. Sorry, Miss Hanson. Yeah, you're absolutely right. It extends the hips. Fantastic. So, they bend my knee, but they also extend my hip. If they extend my hip, they can also be responsible, Miss Hanson, for what type of tilt of my pelvis? Posterior tilt of my pelvis, yeah. And when I have a posterior tilt, my curves of my spine go away, believe it or not. It's not as common to see a posterior tilt of the pelvis, but it can happen. And by the way, because they create 2 movements, because they do this bending of the knee and this pullback, which is bending of the knee, extension of the hip, because they do this, they are nicknamed what? Yeah, walker's muscle. Yeah, they're the walker's muscle. And if you guys ever walk really, really fast, well, try it sometimes. Walk really, really fast down the hallway here at school. Don't run. Walk really fast. You'll feel your hamstrings because they are pulling you forward by pulling your leg back. They're very much walker's muscles. Yeah. Also, a lot of people think when they're doing squats that that's really a quad exercise, but squats, and it is, there's no doubt about it. But actually a lot of your power from squats actually come from your hamstrings, because my hamstrings, when I'm down the squat like this, my hamstrings help to pull, my pelvis is anteriorly rotated right now. My hamstrings help to posteriorly rotate it. They're extremely important in a squat. So are your quads, so are your glutes, but still. Very, very important muscles. One other thing. Another massage tip, kind of like I told you about the sartorius. This is your gluteus maximus, your bottom, right? I would no longer think about this as the bottom anymore. This is just hips to me, right? A lot of people massage the hamstrings and they stop here because for some reason this, I don't know why. The hamstrings attach all the way underneath the glutes. When you rub the hamstrings, you should be rubbing until you hit somebody's bottom, till you hit that bottom, and then you should dig in right here because this is where they attach. And attachment sites are extremely important in massage. Don't just rub the obvious stuff. Get the attachment site. Get both sides here, come up, and go in there. It really is really important, especially for athletes. Really, really important. Cool. All right. So, get the whole leg. That's the point. Get the whole leg. Okay. Questions so far? Don't worry, we'll take a little break here in a minute. All right. So we've done 3 muscle groups, right? We've done quads. We're just reviewing stuff. Quads, adductors, hamstrings, right? Yeah? Miss Stanley. Miss Stanley. Hi, Miss Stanley. Miss Stanley, what are the 4 quads?
Is that the first one we did?
Yes.
Okay. So, vastus lateralis, vastus medius, or
Medialis?
medialis, and then vastus intermedius,
Yep, underneath here.
and rectus femoris.
Cool. Thank you. What are the 5 adductor muscles?
Adductor brevis, adductor longus, adductor magnus, and then gracilis pectineus.
Yeah. Cool. What are the 3 hamstring muscles?
Semitendinosus, semimembranosus, and
2-headed muscle in the femur.
bicep femoris.
Good job. Yeah. Good job. And what other muscle we discussed? The Taylor's muscle that goes diagonal here.
Starts with an S. It's
Good. SAR,
I
TOR.
want to call it sarcomere, but it's not sarcomere.
Yeah, that is least related to muscles, right? SAR, TOR, ES.
Sartorius.
Yeah. Thank you. Cool. All right. Did you all get that? Yeah? Miss Moore.
I'm here.
Thank you, Miss Moore. All right. I hope you got your thinking cap on, but if you don't worry. It's your first day. You're doing great. But do you remember what the 4 quads were, Miss Moore? It's okay if you don't.
The vastus one? Yeah, okay. The vastus lateralis, vastus medialis, rectus femoris, and vastus intermedius.
Bam! Beautiful. do you remember what the 5 adductors were?
You're killing me right now.
Yeah, I'm killing you.
Adductor brevis, adductor longus, adductor magnus, pectineus, and gracilis.
Wow. Do you remember what the 3 hamstrings were?
Bicep femoris. Ooh, freak.
2 semis. Next 2 have the word semi in them.
Semimembranosus and semitiminosus.
Man! You're making the other students feel bad, Miss Moore. What's this diagonal muscle that runs across? It's in its own group right here, Miss Moore. Last question.
Wait, is that the tip of my tongue?
It's going to be very sorry if you can't answer it.
Wait,
You wouldn't be able to play hacky sack if you sartor.
Sartorius?
Yeah, this muscle. Good. Sartorius, great job. Thank you, ma'am. Good, good, good. Cool, cool, cool. Yeah. Miss Hunter. Miss Hunter. Can you hear me? Hello? Zoe. All right, we'll come back to you, Miss Hunter. Miss Nguyen.
Yeah.
Hi, Miss Nguyen.
Yes.
Miss Nguyen, what are the 4 quad muscles?
Core muscle, rector femoris, rector femoris, and rector medialis,
Vastus medialis.
and rector lateralis.
Vastus lateralis.
Medial.
Vastus intermedius. Good. What are the 5 adductors?
Adductor longus, adductor magnus, adductor
Brevis. Brevis, good.
and
Gracilis. Gracilis.
pectineus.
Gracilis. Yeah, gracilis. Good. And what was the little one? What? Pectineus?
No, Alice. I don't know.
Gracilis. Gracilis, yeah. And then pectineus.
Yeah, pectineus.
Good. And what are the 3 hamstring muscles?
Bicep femoris.
Yep.
Semitendinosus.
Yeah. Semitendinosus.
Semimembranosus.
Miss Nguyen, that was fantastic.
Yeah.
Really fantastic. Thank you. Thank you. That was really good. Okay. Thank you. Okay. Last little muscles, and then we'll take a little break. All right, before we kind of move on to new stuff. We've got gluteal muscles, right? Gluteal muscles. Cool. Miss Hunter, are you back?
There, I was trying to use the internet to go through it. But yes, I'm here.
Cool. Miss Hunter, what are the 3 gluteal muscles?
That would be gluteus maximus, minimus, and medius.
Gluteus maximus. Here's medius, everybody. And then, if I can get it off, I think I can. There's minimus, way underneath it. Cool. I love that. Awesome. Thank you, Miss Hunter. Mr. Kandaris, what are the 3 gluteal muscles?
Gluteus maximus, minimus, and medius.
Cool. Thank you, sir. Miss Bilotic, what are the 3 gluteal muscles?
Gluteus maximus, gluteus medius, and then the gluteus minimus.
Cool. Thank you. All right. Miss Yanez.
Yes.
Miss Yanez, of the 4 quad muscles, which one can create an anterior tilt of the pelvis?
The rectus femoris.
Yes, 100% true. Anterior tilt, which is a flexion of the pelvis, really a flexion of the hip. Of the 4 hamstring muscles, which one can create a posterior tilt of the pelvis? He said, making it a trick question. Not an easy question. It's okay. To give you a little help, which one can create an extension of the hip? Because an extension of the hip kind of creates a posterior tilt of the pelvis.
Is it or it's all of them?
Yeah, pretty much. So all of them create an extension of the hip. So let me get trickier. I'm sure you'll appreciate that. Of the hamstring muscles, which heads can create a posterior tilt?
The long head of the bicep femoris, and then the semitendinosus and semimembranosus.
That was 100% correct. Why can the short head of the biceps femoris not create an anterior tilt? Or an
Because
extension?
it doesn't connect to the hip.
That was really nicely said. It doesn't connect to the hip. It only connects to the femur. All it does is help with a flexion of the knee, like all the other ones do. It doesn't matter to us, everybody, because they run really close to each other. You're just going to rub both sides, but it's just kind of understanding where things are located and things like that. Really, really well done. What kind of, Miss Giannis, what kind of tilt could a tight sartorius cause?
An anterior.
An anterior tilt. So it would be a culprit along with the rectus femoris. That's cool. All right, everybody, let's take a 10-minute break now. That was good. That was a lot of review. Let's take a 10-minute break, and we'll resume from there. You guys are already familiar with a lot of the muscles of the thigh, right? We just did them. There are a few more that you are not familiar with that we need to talk about, and we will talk about them in greater length. But I want to just have you familiarized with them so that it's not the first time you hear them when we get to them more specifically, right? So, I'm going to present to you right now just so you can see one of them because it's easier to show you in this slide thing. All right. If you look here, there is a muscle, a couple muscles, that attach the spine, you'll see the low back there, into your femur, into your hips, both. And that's the psoas major and psoas minor and iliacus. I don't know if you can see them in the picture, but I hope you can. They are some of the top muscles up there on the list. And try to find the psoas major, psoas minor, and iliacus. Essentially, these muscles go from underneath, by the way, my belly and everything. They attach to the inside of my spine, the inside of my lower back, which is actually the anterior part of my lower back. And they attach down into what's called my lesser trochanter, which is a spot on my femur down in here. This is basically the psoas major and psoas minor. they do this. The iliacus is on the inside of my hip, inside it, and goes to the same spot. So if these muscles contract, what action would I do, Ms. Petrie? If these muscles contract, what action would I do?
You do a flexion.
Yep, flexion of my hip, absolutely. So these counteract, by the way, my back muscles. There's stuff pulling back here, these kind of pull forward. These muscles cause a flexion of my hip, or this is also a flexion of my hip, everybody. This is flexion. The same thing is actually happening when I raise my leg as when I lower my body. They're getting closer together. If I was floating in outer space, we wouldn't know the difference, really. So psoas major and minor in iliacus create a flexion of the hip. When I'm sitting down in a chair for a long time, working on your grades and things like that, this muscle can become shortened. And when I get up, I can't straighten all the way because I've also got an anterior tilt of my pelvis. So this muscle can cause a lot of problems. The iliacus and the psoas major and minor. Don't worry about the minor so much. Not everybody has the psoas minor. That's why I'm not worried about it so much. It's a very tiny muscle. Not everybody has it. Basically, iliacus and psoas major, what I want you to focus on here. So these two can create anterior tilts of the pelvis, right? So Ms. Torres, we've mentioned now 4 muscles today that can create an anterior tilt of the pelvis. Can you tell me what those 4 muscles are, Ms. Torres?
No. Okay. It's the sartorius.
Sartorius definitely can pull me forward, sure.
Okay. Your rectus femoris.
Rectus femoris can pull me forward, and then we just learned about 2 new ones.
Your psoas major and minor.
Yep, psoas major and minor, and what's the other one?
That was 4, no?
It is, but I wasn't counting the minor, so what's the other one? There's one that starts with it's the iliacus. Yeah, it's on the inside of my hip. They both go down here into my leg. Cool. So the the iliacus and the psoas major go to the same spot, and so most people do not refer to them separately. Most people call them the iliopsoas. The iliopsoas is a shortened term that is extremely common for the psoas major and the iliacus. It's a shortened term to talk about 2 muscles that we think always work together and always go the same place, so why not call them the same thing? And so you very rarely hear people talk about the iliacus or the psoas major. You hear them say iliopsoas. We care about these muscles a lot because we think they create an anterior tilt of the pelvis. Well, we know they create an anterior tilt of the pelvis. We think if they're shortened, they can create back problems. Because if you think about it, they're grabbing on the inside of my lower back. So if they're tight, they actually pull my lower back in. They actually pull my lower back in forward, and it can create a lot of pain in your lower back, because then what happens is your spinal erectors try to balance you out and pull you back, and you've got a war going on there. So many therapists work the back and never work the iliopsoas. And there are reasons for this. One is it's darn hard to get to. So, to get to my iliacus, you've got to go into my hip right by my bladder. And let me tell you, a lot of people do not like having that done, including me. So it's just not fun. To get to my psoas major, you've got to go in underneath my belly, heading down towards my belly button until you get to almost the back of my spine. That's a long way to go in on somebody, and you can do that to people, but it's not super pleasant. My favorite way of loosening the iliopsoas, because it's faster, more effective, and I don't have to dig around people's bellies, is to simply put their leg in an extension. Because the iliopsoas does this. So if I put the leg in an extension and stretch them, that will actually loosen up their iliopsoas. And it's super duper effective. So how might we do that, huh? How do we actually do that stretch? I'm going to try to show you here in class. I don't have anybody to stretch me. Let's see here. Can we temporarily? Aha! We can. Okay. All right. So, if you have a client down at the table like this, right? You want to get their leg up like this. Now, by the way, you don't want to bend it back like this at the same time. And in a second, I'm going to ask why. But you want to just bring the leg back like that. One of the things you can do, you could use your own leg, by the way, to lift their leg. But if my leg is down on a bolster like this, and you push my butt in, you're causing my leg to go back. Does that make sense? There's gap underneath my hip here. Yeah? And if you push my bottom into the table with my leg under a bolster, my thigh under a bolster, you're causing me to do an extension of my hip. And that will stretch the iliopsoas. And it's a super duper important muscle in the body. It is the muscle that connects your upper body to your lower body. It has everything to do with pelvic tilt, and people that work in offices tend to have shortened ones. And you can often, this is not exaggeration, people that are in jumping sports like volleyball and stuff like that, you can often put a couple of inches on their jump by just stretching out their iliopsoas. And here's why. We're going back up here. Hold on. Yes. Hand raised. Yes, Miss Monreal.
Could you just not forget to tell us why you wouldn't bend the knee when you're done?
Mm-hmm. Yeah, but I want you to take a guess too, Miss Monreal.
Well, I don't know because we were actually taught to bend the knee at the chiropractic office. What we would do is bend it, and then we would have them push their hip into the table. We would hold the knee up for them so that we were creating the extension, and they would squeeze the glutes and push their hip.
Oh, that would actually probably work. You just can't bend it too much, and I'll explain why.
Well, please tell me why, because my answer is I don't know.
Okay, good. I'll tell you in just a second. But when you jump, you go up like this, right? Well, if my iliopsoas is tight and I jump, I do this. I can't open up my body. And I want to open up my body to jump. And so opening up the iliopsoas allows somebody to completely extend up. It allows them to be a better jumper, even though it's not where the power of the jump is coming from. It's the thing stopping the jump. So this is a fascinating, fascinating thing about sports massage. If I loosen up, if somebody has muscles that are opposing them, they're fighting themselves, and I loosen them up, they instantly appear stronger. If I'm doing bench press, but my back muscles are tight, when I'm bench pressing, I'm not only lifting this weight, I'm also pulling against my back muscles. So if you release my back muscles, all of a sudden it seems like I'm stronger because all this power is now going to the movement. Right? Releasing the iliopsoas doesn't make me stronger jumper, but it means the thing that was stopping me from jumping is out of the way, and it will seem like I am more powerful. If my little Honda Fit is towing a trailer and then you unhook the trailer, it's going to seem like my car is more powerful now. The car isn't more powerful, it's carrying less weight. It's got less resistance. And so a lot of what we're trying to do for athletes is remove the impediments to their performance. Is to make sure that when they run or jump or whatever, that they're not being held back by their own muscles. That's why we do it. So, Miss Monreal asked, she said, please don't forget to tell us. The reason we don't bend the knee too far is if we bend the knee too far, you won't hurt them. If you bend the knee too far while you're trying to push the hip forward, you end up stretching another muscle, and that muscle ends up stopping the iliopsoas stretch. So if I bend the knee too far while I'm extending the hip, what muscle do I end up stretching instead of the iliopsoas? Yes, Miss Monreal.
Is it the rectus femoris?
Yes, you're 100% correct, and now let me visually show all of you why that's true, because you really need to visualize this. Okay. Here's my rectus femoris, right? I'm exaggerating all this so you can see it, I hope. Right? This muscle goes across my hip and my knee. So if my knee bends, it gets tight, and if my hip goes back, it gets tight. So when my knee bends here, it's still loose up here. As my hip goes back, it gets tighter and tighter. If I unbend my knee, my hip can go back even further. Right? So I want to stretch just my iliopsoas, which just goes from here to here. My iliopsoas only does one thing, it flexes my hip. So when I push my hip back, that's fine. That's what stretches it. But if I start to bend their knee too far, this rectus femoris gets too tight and it stops me from going back. Have you ever noticed that when you do a quad stretch on somebody, their butt comes up like this off the table when they're face down? That's because their rectus femoris is tight, and that's how they're getting extra space in it. Push their butt down and they'll feel the stretch even more. So you don't want, it's fine to bend the knee when you're stretching the rectus femoris, but you don't want the knee super bent when you're stretching the iliopsoas, because it stops that movement. We'll try to demonstrate this in lab at some point so this all makes sense, but it's stuff for you to think about. But I'm a big believer in iliopsoas stretches, however you manage them. Because my problem is when you go in to rub the iliopsoas, not only can you not get to it very easily, and not only is it really invasive to the client and all that kind of stuff, but it takes a long time and you can't rub the whole thing. You only get into a tiny portion of it. And so I just think it's better to stretch it. That way you stretch the whole thing, it's quicker, it's more effective. So that's two new muscles that we haven't really talked about a lot. The psoas major and the iliacus, known as the iliopsoas. And they create a flexion of the hip. And we will come back and discuss them, by the way. But I wanted you to hear about those before we come back on a day and just discuss them by themselves. There's also 6 other muscles that go together that I want you to hear about before we get to them. We won't discuss them today in detail, but I want you to have heard about them before we go further. I feel like this thing is really close now. Okay. If you pull off the gluteus maximus, which you can't do to a client, but you can push through it, underneath here in this small little portion here are 6 tiny muscles. And these 6 muscles are called the lateral hip rotators. Ms. Cooper, What are these 6 muscles called, this group?
The lateral hip rotators?
Yes. Yes, yes, yes. Miss Bilotic, what's this group of muscles in here called?
The lateral rotators of the hip?
Yeah. The lateral rotators of the hip, or the lateral hip rotators. Both are absolutely correct. Perfect. Miss Moore, what are these muscles in here called?
The lateral hip rotators.
Yeah. You will also hear them referred to, they are very deep because they're underneath the glutes. They're very deep and there's 6 of them. So you'll also hear them referred to as the deep 6. Technically they are the lateral hip rotators, but they're also known as the deep 6. There are 6 of them. Yeah, cool. Miss Felix Osuna, what's this group of muscles called?
Lateral hip rotators.
Yep. And what's kind of the nickname for them?
Deep 6.
Deep 6. Yeah. Deep 6, because there's 6 of them. And they're underneath your butt. They're underneath your gluteus maximus, and you can access them. Meaning, you can push through the glutes and hit these directly. And we care because one of them is very famous for pinching the sciatic nerve. Can anybody tell me which one of the deep 6 is known for hitting the sciatic nerve? Miss Monreal, you have your hand raised.
Is it the piriformis?
It is the piriformis. The piriformis is one of the deep 6. It's one of the lateral hip rotators, right? Piriformis pinches the sciatica. By the way, I think some of the other ones can too, but that's its reputation. I don't think you can go a day, but you definitely can't go a week working at an Elements or Massage Envy or a busy spa and not hear somebody mention the piriformis. You think we're often working your glutes when we're pushing our fist and stuff in there and poking into your glutes, but quite often a therapist is trying to get in and release your piriformis, loose up your piriformis. Because your piriformis can pinch the sciatic nerve and cause all this problems, numbness, and pain in your glutes and down your leg, especially down the back of your leg. Piriformis. Yeah. So, again, we're going to have a whole day where we talk about these, but I just wanted you to hear about them. So you know that the deep 6 are found underneath your gluteus maximus. Deep 6 are found underneath your gluteus maximus. Cool? And the most superior one. Yeah, the most superior. Miss Hunter, what does superior mean? Hunter?
You're saying what does superior mean?
Yeah, what does superior mean?
It means on top.
That's superficial. What does superior mean?
Well, inferior. Oh my God. Well.
I mean, on top was close, kinda, but on top makes me think superficial.
I mean, I think when I think superior, I think the top half, not like on the.
Sure. In that sense, you're right. It means above. So the most superior of your deep 6 is the piriformis. It's the highest one up here. The most inferior one, look how little difference there is here, by the way. Piriformis, this is the lowest one. All these live in this tiny little spot here. Is a 4-sided muscle that attaches to the femur. Anybody want to guess what a 4-sided muscle that attaches to the femur is? You know about a 4-sided muscle that's in your lumbar region. What would a 4-sided muscle that attaches to the femur be called? Yes, Miss Monreal.
Quadratus something.
Yes, quadratus something is exactly right. Quadratus means four-sided muscle, not quadriceps, not four-headed, four-sided quadratus. Just like quadratus lumborum is your abdominal muscle found in your back, right? Quadratus lumborum. This is quadratus, and it attaches to your femur. Take a guess.
Quadratus femoris.
Thank you. Quadratus femoris. So your most inferior, and it's about 2 fingers wide. Deep 6 is here. Your most superior one is here, right? And the other 4 are found right in here. That's how tiny they are. These are a tiny little group of muscles here. Got the piriformis, most superior, quadratus femoris, most inferior. And they're in this tiny little pocket here underneath your glutes. So, Miss Yanez, what is the most superior of the deep 6?
Oh no, I can't remember.
Well, this is the first time you've ever heard this, Miss Yanez. It's fine. It starts with a P.
The piriformis?
Piriformis, yes. And that's the one that can pinch the sciatic nerve. You get tight. And what's the most inferior one? The four-sided muscle attached to the femur.
The quadratus femoris?
Yes. So you got a piriformis and quadratus femoris. I'm going to tell you guys the name of the other 4 so you've heard them. You have 2 gemelluses and 2 obturators. These are not easy names. You've got a gemellus superior, gemellus inferior, an obturator internus, and an obturator externus. And later we'll find out why, but they're very tiny and they live between the piriformis and the quadratus femoris. So, gemellus superior, gemellus inferior. Obturator internus, obturator externus. That's just so you've heard the names of the deep 6 before we get to them, when we get to them. All right, so that's just preview of coming attractions. That wasn't meant to like overwhelm you. It was just meant to kind of give you an idea of stuff. So when I talk about it again, you've at least heard about the deep 6, which are the 6 lateral hip rotators, which are the piriformis, which can pinch, pinch, piriformis, the sciatic nerve, the quadratus femoris, and the other 4 deep 6 that live between those 2, which are gemellus superior, gemellus inferior, obturator internus, obturator externus. If you're feeling a little overwhelmed right now, you should. That's fine. But they all do the same thing, by the way. And they all live right here. And when I'm working on somebody, I'm not usually like, oh, that's the gemellus superior and the gemellus inferior. You can't even feel the difference. You can find the piriformis and you can find the quadratus femoris. But the other little ones are very hard to find them individually. And there's no need to. You would just hit them all. They all do the same thing. You'd loosen up this area underneath the glutes because it could all pinch and affect the sciatic nerve. Okay. And we're going to learn about it. This is just preview of coming attractions. Don't worry about it. Okay. Let's talk about why we're here today. We're here today to talk about the glutes. So if you look at the slide presentation going on right now, you can see this large muscle on the back side of your body that gives you the shape of your bottom. It is your bottom. Your gluteus maximus really is your bottom. It's what gives shape to your bottom. And let's look at what it does. It essentially attaches into the side of your sacrum here. Attaches to the side of your sacrum and goes down and hooks into your IT band and a spot, a little nodule on your femur called your gluteal tuberosity, go figure. So it hooks your sacrum here, which is why when we rub on people's sacrums, we don't just rub the sacrum, right? We're trying to rub the sacrum because it's got the multifidi on there. You probably forgot about that. Multifidus. But we also rub off the edge of the sacrum because that's where the glutes attach. Don't just rub the glutes like this. Get them right here where they attach on the edge of the sacrum. It feels amazing. Amazing. You should be trying to trace out the sacrum on anybody you work on. I'm often trying to get right here. right? You're not all the way down here where their coccyx is and stuff, but you're right up here trying to loosen this up. Anyway, the glutes go down and they insert into the IT band, right? And they insert into the femur too. And they help us do a powerful extension of the leg. Powerful. They also help us, by the way, do lateral rotations of the leg too and things like that. But powerful extension of the leg. That's why you do squats to work your glutes. You're really working your gluteus maximus when you do squats. Cool? This is a good side view. You can see the gluteus maximus coming into the IT band. So when people's glutes are tight, it can make their IT band tight. And why is that a problem? All sorts of reasons. Let's take a look. When my glutes are tight, my gluteus maximus, I should say, not all my glutes, but I've got this IT band, remember? It's like a long tendon that kind of goes from my hip all the way down to here. The glutes hook in here. Gluteus maximus hooks in here. When this is tight, it can pull my knee off for one thing. That's not good. But the other thing is this band, if it's tight here, every time I take a running step, the IT band can click by the epicondyle of my femur or the greater trochanter of my femur. These bones sticking out of the side, these bumps sticking out of the side here. Well, if that happens a lot, you're a runner, you can get IT-itis, iliotibial band-itis. You can get inflammation here because the glutes are so tight, they're making this band too tight, which is making it rub on the sides of my femur. So that's a very common problem. So loosening up glutes can really help loosen up IT bands. And people will come to you all the time with tight IT bands, and you want to rub the IT band, but you definitely want to rub their glutes because glutes insert. The gluteus maximus inserts into the IT band. Did I mention the gluteus maximus inserts in the IT band? If people have tight IT bands, you might want to rub the gluteus maximus. Just don't forget that. All right. The other two gluteal muscles aren't really behind you. They're on the side and in front. So this is gluteus maximus and back, but gluteus medius and minimus is underneath this one, are on the side and in front. Yeah. So really, when you think about your, I'm sorry, but just this, when you think about your butt, that's your gluteus maximus, and that's what gives shape to it. When you think about your hips, your hip bones are obviously your hip bones. Like they're the crest of the ilium here and things like that. But your hip muscles, like your hips, are really your gluteus medius and gluteus minimus. They're on the side of your body, right? So they're not responsible for a powerful extension. They're not behind you. Things behind you pull stuff behind you. Things in front of you pull stuff in front of you. Muscles can only contract, remember? Gluteus maximus might be responsible for a powerful extension of the hip. Gluteus medius, by the way, can do all sorts of things, but gluteus medius is on your side. So what action would the gluteus medius probably create? Miss Hanson, I feel like you know this, yes? 100% all day long. Thank you. It's on the side, so it pulls to the side, right? It pulls your leg out. So when you're doing leg lifts to the side, it's kind of like the deltoid for your leg. But anyway, when it does leg lifts to the side, it's doing an abduction. By the way, it does a couple other things, but I'm just trying to give you an overview here. So the gluteus maximus is in back. It pulls the leg in back. That's called an extension. Gluteus medius is on the side. It can actually help with abductions of the leg, lifting your leg out to the side. And by the way, that may not sound like such an important thing to do. Like, you're like, well, yes, it's important if I'm a ballerina, right? That I can pull my leg out to my side. But think about it. When I stand on this leg here, right, I've got this other leg lifted, right? It's my gluteus medius that's keeping me from falling over. It's abducting me right now so that I can stand here straight. If it didn't do that when I lift this leg, I'd be like this. But what it does is it engages like that. And when do I lift my leg up? Not like this, but just a little bit. Every time I take a step. Every time I take a step, the leg that lifts up, the opposite leg, the gluteus medius, keeps me standing erect. So super important functional muscle. And then the gluteus minimus is a tiny bit in front, believe it or not. We'll see if we can get to it here. Hold on. Gluteus maximus is coming off. Gluteus maximus overlaps the gluteus medius a little bit. Gluteus medius is coming off. And, oh geez, come on. And gluteus minimus. Now gluteus minimus is all over the place, but there are some fibers up in front. There's some fibers in back too. But there's some fibers up in front. Since there are some fibers up in front, Miss Hanson, what can the anterior fibers of the gluteus minimus do?
Rotate.
What can the anterior fibers, they probably could help with the rotation by the way.
Adduct.
Not medial fibers.
No, that would be,
They attach to my...
Back in, adduction?
So they're in front, so tell me an action that happens in front.
Oh, flexion.
Thank you.
Sorry.
Flexion of my hip, which is also an anterior tilt of my hip. So the gluteus minimus can also affect pelvic tilt. Create an anterior tilt. Yep. So that's a lot of muscles that can create anterior tilts, by the way, that you have to work on when somebody comes to you with an anterior tilt, which is causing back problems for them. Who can name the, hold on one second, 5 or so muscles that can create an anterior tilt of the pelvis? Who can try to name? How about that? Better question. Who wants to try to name the 5 muscles? Miss Monreal, you think you got this?
I didn't mean to hit my hand, but if nobody wants to guess, I will.
Nobody wants. All right, Miss Monreal, take it.
Ah, shoot. Okay.
Just remember, by the way, they have to be in front to make the hip move in front, right?
Okay, so I'm going to go with gluteus. Was it the medius that you just said was in front? Or is
Minimus. And by the way, this is helpful to everybody. It goes max, med, min. You go more forward as you go each glute. So max, med, min. So think about that. So it's your minimus. Yeah. So gluteus minimus, at least the anterior fibers, not the whole thing, but the gluteus minimus can create an anterior tilt. Yes.
Okay, what about sartorius?
The sartorius absolutely can create an anterior tilt.
Okay. Hold on, I see you pointing at it. What is the name? Rectus femoris.
Rectus femoris, absolutely. Okay. And then we just learned some new muscles today that attach to my lower back and attach it down into the inside of my hip. They go by one name, but it's actually 2 muscles. Yeah, psoas major and iliacus, which we call the iliopsoas. Good. So that's 5 things to approach when somebody has anterior tilt of the hip. And in general, by the way, everybody, it probably wouldn't mess somebody's back up to work those even if they didn't have anterior tilt of the hip. So what I mean is, if you're wrong about their tilt, it probably would still not do any damage to work them. So it's not a bad thing if you're like, yeah, they might have some anterior tilt. You're not like making a huge mistake to try to loosen those muscles up.
Okay, but what is that going to look like to us? Okay, so somebody walks in and we notice they're walking a certain way?
Yeah.
Or...
Yeah.
Okay.
What you're looking for what you're looking for to know if somebody has anterior tilt is you can actually look at their hips and see if they're kind of tilted down. Think about this. When I have an anterior tilt, the top of my hip goes forward. So what happens to the bottom of my hip? Look for this. Look for people that have their butts sticking out. Look for people whose back is really swayed because they're trying to get back over their head, back over their hips because their hips are rotated. This is very common. Now you're not going to see it this bad. You're usually going to see something kind of like this. And they're going to complain about neck problems because their head's out over here. But this is an anterior tilt. When you see people's butts sticking out, that's quite a good sign they probably have an anterior tilt.
Okay, can I go over those muscles again?
Yes.
Okay, so it was gluteus minimus, correct?
Yes.
Okay, sartorius.
Yep.
Rectus femoris.
Yep.
Iliacus and iliopsoas.
Iliacus and psoas major.
Okay.
Which are referred to as iliopsoas, yeah. So what I would do with them is I'd be rubbing the front of their thigh all the way into the hip bone, quite a bit, and I'd be doing extensions of the hip to try to loosen up their iliopsoas. That would be a very common thing to add to my back routine. Right? So you do all this great deep tissue elbowing work on the back, but that would be a very great thing to do to the lower body to help the back. Yeah. In a lot of people. And probably almost never a bad thing to do. All right, so we got the glute max. I already talked to you guys about the 6 lateral hip rotators. We will talk about them another day. Don't worry about it. Here is a side view of the psoas major coming down and kicking in the hip. It shows you how deep it is. All right, but today we're actually talking about the gluteals, and your test today will be on the glutes, yada, yada, yada. So let's talk about the glutes. Gluteus maximus, this is your bottom. This is what gives shape to your bottom. Its origin is on the coccyx, which is your tailbone. Can you guys see my pointer here, by the way, in the slide? Show? Does that show? Good, okay. This is your coccyx. This is your tailbone. The edge of the sacrum. The posterior iliac crest. Remember your iliac crest is just your hip bone? They're just saying the back part of your iliac crest. Oh, sorry. Let me go back. Hold on. Sacrotuberous and sacroiliac ligaments. Do not worry about those. Not because they're not important, but you've got all these ligaments in here that tie your hips together, and it's just saying it's sewn into those. Here's what I want you to remember from a massage therapy point of view, what you've got to rub. Your gluteus maximus has an origin of your posterior iliac crest going into the edge, lateral edge of your sacrum going down into your coccyx. Remember, it goes down this line so you can rub this. Don't just rub this. You should rub this on everybody. Just put a fist right here. But get this insertion right here. Darn it. Get this insertion right here. Rub right off the sacrum. And get this. So essentially the origin of the gluteus maximus is the posterior iliac crest, the back of the hips, the edge of the sacrum, and the tailbone, the coccyx. Now it goes running over here and inserts into 2 different areas. The IT band and the gluteal tuberosity, which is a bump on your femur. There's a bump down here, the gluteal tuberosity. Remember the deltoid tuberosity? The deltoid goes into it. This is the gluteal tuberosity. It's on your femur. That's what it grabs onto. So its main function, when it pulls, you can kind of see that it's going to pull the leg back, and that's to extend the leg. But because it's also grabbing on the side of the leg, if it pulls, because if it's here, if it pulls, it can pull my leg back. But because it's also going at an angle, if it's kind of diagonal, it can laterally rotate my leg. Laterally rotate my leg. Yeah. And because of all that, it can abduct the leg. It's pulling it out. But the main thing I want you guys to think about is the fact that it attaches to the IT band. It can affect IT tension. It's a powerful extender of the hip. But this is why you see people in the gym when they're on all fours working their glutes. They bring the leg back and they rotate it out. Because what they're doing is working the whole gluteus maximus by doing that. Bring the leg back and rotate it out. Try it. You'll feel it. That's your gluteus maximus. Did you say something, Miss Torres?
So I have a question.
Please.
So when you do the leg, yeah, I have a question. So when you do the leg back and you rotate it to the lateral side, like you did right now, you are working the maximus and the medius?
I mean, yeah, you could argue you're working all three.
You put the foot inward.
You.
And then when you're putting your foot inward, you're doing the medius.
Well, okay. Hold off. I don't mean that like hold off in your. But the other muscles.
No, I know.
Okay. The other muscles are complicated actually. They've got fibers going different directions. So you are working all three. But the point is when you for the gluteus maximus, when you bring your leg back, that's working it, and when you rotate it out laterally, that's working it. So people that are trying to get a really tight contraction on it, bring it back and rotate it out laterally. Yes, that does work some of your other gluteals, parts of them. Okay. We'll talk about that right now.
Okay.
So let's go to gluteus medius, right? Gluteus medius is this guy, right? And gluteus medius, because it goes to multiple places on the femur, because it's got front fibers and back fibers, the back fibers can pull the leg back, extend it, the front fibers can pull it forward. It's kind of like the deltoid. It's kind of like the deltoid for your femur. Remember my deltoid? I've got front fibers. Remember the deltoid? I had front fibers, I had back fibers. Not doing very good with my fibers. Back fibers, right? The back ones pull it back, front ones pull, and I even had side fibers. The gluteus medius is very much like that. It's all over the place. Yeah, I did. I did, you smart ass. So, obviously the fibers back here can pull the leg back. The fibers in front can pull it in front. I think of it mainly as its abducting ability, because it's on the side. And I don't get very nitpicky with that. But anyway, it can do multiple things because it's like a deltoid. That's something kind of important to remember. It, by the way, another important thing, its origin is really right underneath the crest of the ilium, the side of your hip bone here. Now, they'll tell you all this really confusing stuff in your book about between the posterior and anterior gluteal lines, which are lines inside your hip. They're little ridges inside your hip bone. Not inside, but if you go underneath here, there are ridges in your hip bone, and those are called posterior and anterior gluteal lines, and it's attached in there. But just think of it as attached in your hips. Let's keep it simple, because that's where you would rub. And then it goes down to your greater trochanter. It goes down into your femur. Once again. And then let's look at gluteus medius. I shouldn't have put this back on. Minimus on it. If you pull this off, you've got the gluteus minimus. It's tiny, it's underneath here, and it's even more forward. So its main job that I care about is flexion of the hip, because it can affect an anterior tilt because it's in front. I realize the book says it can do some other things. Yes, it can kind of help to medially rotate a little bit. Yes, it can pull your hip out because it's on the side here. Yes, that's true. Yeah. But if you were rubbing the side, rubbing the gluteus medius, you'd hit it too. But the part I care about is right in front. Right in front is where it can affect anterior tilt. So, let me see if that stops us right there. Yeah. So let me stop sharing there. Good. Okay, so let's think about this for a second together. We're just covering the glutes today. Everything else was review. All right. Good. I'm going to put this camera down a little bit so we can see what we're talking about here. There we go. Good. All right. This is the crest of your ilium. When you come down here, you've got a bump on both sides. You've actually got two bumps. One's superior, one's inferior. They're both in front. Who can tell me the name of these two bumps? They're super important. Yes, Miss Petrie.
Are they the superior and inferior iliacus? Something. Let me see.
You're on the right track, my dear. One is the superior iliac.
Is it iliacus?
Well, no. Iliac. But these things, when they push out like this, we call them spines. Yeah. Spines. So this is the superior iliac spine, and this would be the
inferior iliac spine?
Yes, almost. So hold that thought, that's correct. Okay. But in back, you've got, believe it or not, where are they? In back, you've got a superior and inferior iliac spine also. So how do I tell the front ones from the back ones in the name?
Goodness. Oh goodness.
Because you got to add something to what you said.
Right. Okay.
We're talking about the ones. Yeah, go ahead.
Trochanters? Is that what you're talking about?
No, I love that. I love where you're going. But what's the word for in front?
In front is in front would be superior.
That's up.
Oh, front would be frontal. Medial.
That's middle.
Intermedial.
That's between.
Oh God.
I know.
I don't know.
I know some of these questions can make you feel like small and insignificant, like a little ant. You know?
Oh, Mandy says it's interior.
Anterior sounds like ant. I wonder why I said ant. Okay. So this is the anterior superior iliac spine. This one underneath it.
Anterior inferior iliac spine.
Yes. Well done.
And then we have anterior inferior iliac spine.
Yeah. Anterior superior iliac spine, inferior iliac spine. Posterior superior iliac spine, posterior inferior iliac spine. Right? Actually, it's
okay.
Anyway, why that's important in front is when you're trying to work on anterior tilts. You want to be working right in this area, right below the anterior superior iliac spine. By the way, the anterior superior iliac spine is where the sartorius hooks into.
The sartorius hooks into the anterior superior iliac spine.
Yep. And the rectus femoris.
Well, you're speeding up too fast now.
Okay.
I can only write so quickly.
Okay.
Okay.
Sartorius hooks into the anterior superior iliac spine.
Okay. Go ahead.
And the rectus femoris hooks in 1 inch below. The rectus femoris hooks into the anterior inferior iliac spine, which you guys have never felt. Myself probably included. The anterior inferior iliac spine is hard to feel. There's too much stuff on top of it. But you've all felt on your own bodies and other people's, hopefully, the anterior superior iliac spine. If you feel down in the front of your hips here, that bone that sticks out, that's the anterior superior iliac spine right here. That bone
Which is
right
connected to the
sartorius.
sartorius.
But why I'm telling you is when you're rubbing up somebody's legs, you want to rub until you hit that bone if you're trying to affect anterior tilt. Don't rub up between their legs, I know, but you can rub all the way up somebody's legs without being invasive and get to this bone. You can rub up all the way up somebody's legs and get to this bone. You've got to rub in this spot right here to loosen up the muscles that pull the pelvis down. You've got to get in this spot right in here, which is right below the as is, the anterior superior iliac spine, that hip bone in front. The bone that we see on swimsuit models, right? The bone that's sticking out right here, but you can feel it on anybody. You can feel it on me. With all my extra weight, you can still feel it. I can feel it right now. It's pokey. I don't try to run over it, but I try to run into it because that's where the stuff is. And by the way, just to show you guys, there's so much tendinous stuff here. It can take a lot of force. You need to be going in there with lots of force, not lots of digging, but lots of force to stretch that area out, to open it up. And I'm telling you all this, making such a big deal out of it, because most massage therapists rub about halfway up the leg because they're terrified of this area. Well, I'm not telling you to rub their groin, I'm telling you to go up the leg and get into this muscle in here. Because when I rub right here, when I rub right below the as is, the anterior superior iliac spine, I am right now, my hand right now, is pushing on the insertion for the sartorius, the rectus femoris, and if I go just a little bit over, I'm getting the gluteus minimus and medius. Just right here. Super duper important. Any of you that played with Barbie dolls or anything like that, where their legs attached, that's kind of the area I'm talking about. This little diagonal right here, hit right here. This is the place to loosen up those muscles right here. Yes, Miss Monreal.
Yeah, sometimes you don't see my hand, so I unput it up and then I put it back up. Anyway.
That worked.
Well, I really appreciate that you tell us, like, a lot of massage therapists are terrified to do this, because I think in general, even how you were talking about the glutes and this area, we have a fear of being inappropriate. But
sure.
When you're drilling that into us and that it's so necessary, then I think it just puts more of that freedom to come at it, from a therapeutic aspect.
Yeah.
And not be afraid to do that. I don't know. I would like everybody else's feedback. Do you guys feel weird about working in those areas?
Oh, by the way, I appreciate being appreciated. Thank you, Miss Monreal. I feel like you get what I am really trying to do as a teacher. You guys can Google anatomy, right? I'm trying to tell you how the anatomy applies to massage therapy, and from experience what really affects structural stuff and what really affects change and the stuff that people don't do, so that people will be like, gosh, when I go to those therapists there from Gateway, my God, they work stuff so differently than other people, and I stay feeling better longer. they seem to get more results. It's worth a $100 massage from them because I feel like I get $100 worth of results. I go to somebody else, and even though they only charge 50 bucks, I don't feel like I get enough money's worth out of it. I'd rather pay double from this other therapist. I'd like you guys to be those therapists. And yeah, I think you should avoid the groin, right? This is not a good place to be rubbing, right? But I'm actually not talking about the groin. So this is my groin. If you look at my hand, I'm talking about rubbing here. Look how far I am away from the groin. I'm not talking about down here. I'm talking about here. My as is here, right here. Look how far my hands are apart. I want to get right here. So the key is you come kind of laterally with a forearm right here, right there. That gets you right in, not an elbow, by the way, you'll kill them. But just a forearm right down in here like you're trying to pop the leg off from the hip. And you're actually at the side of the table, you're not coming from the side, you're not coming from the top, you're coming from like a 45-degree angle. This is very effective. Pushing right in there. And it's not invasive at all. And it feels amazing. Amazing. Absolutely amazing. So play with that. That's why we're learning this stuff, right? And when I take my arm, just to let you know, if I rock my arm from underneath the crest of the ilium, right here at the crest of the ilium, at an angle of 45 degrees and going down 45 degrees, right here I'm hitting gluteus medius, gluteus minimus, sartorius, rectus femoris. I'm hitting most of the muscles that cause anterior pelvic tilt. Then if I take the client and I push their hip down into the table and pull their leg back, I'm getting the iliopsoas. And now I've done a lot to help with pelvic tilt. Yeah. Okay, we're going to come back to those points again because it's a lot. We're going to come back to those points again, but I'd like you to take some brief tests and stuff on this stuff to kind of force you to read through the book a little bit and process some of this information, and then we can talk more. And I don't want to start you out with loads of homework. So let me go in here and release, I think there's 2 assignments associated with this lesson. Hold on. Boom. Boom. Okay. I've released 2 assignments. They're 50. They both start with 50. And see if you can't work on those right now, so I'm around to ask questions, and so you don't have these. Let's just see what you can do. I don't think they're terribly long. They're just about the glutes. So check them out. I'm here. We're live. Don't go anywhere. Miss Moore, you have not done this before, so I might need to help you with this part. Do you have... Okay. Do you have access to your canvas?
Yes.
Okay. Can you see something on your canvas that says PMP 220? It's probably on your dashboard.
I see courses.
Good. Good. And you should only have a couple courses there, maybe only one. Pick PMP 220.
Okay.
Okay, have you done that?
Mm-hmm.
You should be looking at a picture right now of somebody with 2 fists pushing in the back of a leg. Do you see that?
No, it has assignment, like it went in like a...
Oh, it went right to assignments?
So it has so it has home, front page, and then it has assignments.
Good.
And then discussions, grades, like
Okay.
it went like that.
Click on assignments.
Okay. Okay, I see it.
Good. Click on the first one that says 50 assignment gluteals vid. It's a video. And try to read the instructions and just see what happens. And don't stress, by the way. We'll work it out.
Okay.
And I'm here to ask questions and all that kind of stuff.
All right, thank you.
Thank you. I'm so glad you're here. right back, everybody, in case you have questions. And by the way, don't forget there's 2 assignments, everybody, so if you finish one, do the other one. Yes, Miss Moore. What can I do for you?
Okay, so since I logged in on my phone, I'm going now to go to the video and it's playing, but it's like really low, so like I really can't hear it.
Right, and it might help if you drop off the meeting call with us right now when you listen to it.
Okay.
If not, Miss Moore, you could work on the second assignment.
Okay.
Just make sure you get back on this call after you're done looking at the video.
All right.
Mr. Capscott?
Yeah. What, Miss
I
Stanley?
kind of have a question on number 9.
All right, so you're in the test?
Yes.
All right, let's see. I'm going to look at number 9.
Well, I got it wrong, but I kind of know why. I got confused why the other answer wasn't there, but I figured maybe I was wrong initially, but now I know I was right. I'm kind of like, what?
Oh, well, let's find out, because you're right, I'm kind of curious now. Bear with me.
Okay.
I want to go look at
I
it.
think I was right, I'm pretty sure, but...
Well, you know, sometimes our tests are not right, so...
Well, it says it's this other answer, but I felt like it was... I don't know, I'll explain it when you see it.
All right. Which movement of the hips will shorten the upper fibers of the gluteus maximus? Gluteus maximus. Oh.
I thought it was abduction, and it wasn't there, so I figured adduction might have been right, because it was, like, misspelled by accident. But then it told me it's lateral rotation, but it's just, I don't know.
Well, that is the function, right? When the muscle fibers contract and get short, it creates a lateral flexion, right?
Right.
And I don't think it creates an adduction, the gluteus maximus.